Smoking and vaping are, I would say, the worst possible things you can do.
Is that baby really going to be ours?
Look, legally, I am going to be in jail if I do something that is, not what you have consented to.
How serious do you think fertility decline in India really is?
Ovarian aging is happening about 2 or 3 years earlier than it is happening in the Caucasian population. 1 in 6 couples actually faces fertility problems, and it's a huge epidemic.
Now, when they walk in, are they really scared of being judged?
At least at Motherhood, have a safe space.
If you intend on becoming parents, then you need to consider your biological clock.
Peak fertility for women is in their 20s. The lifestyle cost has increased so exponentially that you want to have a certain bank balance or a certain corpus before you think about having kids.
Is there really any truth to the fact that something is really unexplained?
30% of cases are due to the male factor. About 40% or so are due to the female factor. The lesser the number of eggs you have, the more the complications, the more trouble also you have conceiving.
Can you tell me about egg freezing?
You always have a backup of eggs. It's like an insurance in the bank. Everyone in those initial few sexual experiences can experience some amount of discomfort. This is almost about 50% in women facing infertility. The success of an IVF would be 10-20%, and now we are at 50 to 60%. IVF is science, and just like cancer requires chemotherapy, fertility problems sometimes require IVF.
Hello everyone, and welcome to the F Word podcast, where we explore ideas, challenges, and conversations that are shaping lives today. In a world filled with F words, food, fashion, fitness, finance, today's F word is fertility. Yes, you heard it right. Most of us don't think about fertility until we have to. We grow up believing that when the time is right, our bodies will cooperate. But unfortunately, for millions of people, this assumption quietly breaks, and it leaves behind guilt, shame, and a lot of unanswered questions. We're also seeing trend in how parenting is being approached lately. For the first time in history, we have couples who are choosing to become parents at a later stage in life. And we're building careers, navigating through stressful life, and living in environments our bodies were never designed for. And in a time like this, what fertility means to you and me is slowly changing. So to break this down for us and to give us an end-to-end understanding of what fertility and infertility really is, I have with me Dr. Bhavana Girish, an obstetrician, gynecologist, and an infertility specialist. She has over 12 years of experience in reproductive medicine and assisted reproductive technologies. Not just that, she was a gold medalist who secured her MBBS from KIMS Bangalore and completed her advanced training in infertility and IVF. She also refined that skill from PGI Chandigarh. She currently works at Motherhood, and needless to say, her expertise spans across different reproductive specialization. And today, she is going to teach us everything that we need to know. I'm super excited to have this conversation with her. So, hello, Dr. Bhavana. I am super excited to have you here with us. I'm very intrigued to see how our conversation is going to go.
Hi, Sishma. Really nice to be here.
Yeah. So, I'm going to dig straight into it. It is very nice to see that people slowly started talking about fertility. But it's very interesting to see that infertility is the talk of the town lately. So globally, a lot of people are saying that the fertility rate is actually declining. So how serious do you think fertility decline in India really is? Are we seeing a clear trend?
So definitely, yes. I think fertility decline or infertility is very much on the rise, not just in India, but across the world. You hear our politicians talking about it every day, where they say the birth rates are declining. They're trying to encourage people to have more children, but unfortunately, people are not able to. A combination of lifestyle, biology, environmental factors, all of these. So earlier when we were studying 10-15 years ago, we would say that the prevalence of fertility problems in India is only about 5 to 10%. But recent studies have said that it's as high as about 25 to 30%, especially in the urban areas, Delhi, Bangalore, metros. So that's, a marked increase that we are seeing.
Okay.
So right now, I would say that 1 in 6 couples actually faces fertility problems. And it's a huge, huge epidemic, in fact.
Okay. In fact, I like how you said the urban lifestyle, right? So could you stress a little more on that? Is it the environment you're living in, the food we're eating, the stress of corporate work life? What is it?
I think all of those things that you mentioned, people are getting married later now. They want to be financially stable. They want to be emotionally and mentally ready. And in those 20s and early 30s, most people are unfortunately not able to give time for their health. So that means stress. This is work stress, educational stress, financial stress, poor lifestyle habits, people living away from home, eating a lot of your, rapid Swiggy, Zomato type of food. People who are constantly exposed to radiation from mobiles, laptops, gadgets of all sorts, and putting all sorts of chemicals into their body with alcohol, drugs, many other things. So all of these things definitely
Sounds like an average lifestyle.
Really.
Okay. So I like how you said, people are waiting to have kids, either because they want to be emotionally prepared, financially prepared. So there is this whole deal about, we will choose to become parents at a later stage.
Right.
Now, does that really affect fertility as much as people think it does?
Yes, significantly. I think
Okay.
At least in my generation, our parents had us in their early or mid 20s. And the concept of being ready to be a parent was not even in the equation, right? It was assumed that you get married, you have a kid like a year or year and a half after getting married, and that's done.
Yeah.
Now, you have people getting married later, late 20s, early 30s, mid 30s even. And then the lifestyle cost has increased so exponentially that you want to have a certain bank balance or a certain corpus before you think about having kids. So unfortunately, biology does not follow the same clock. It is very, very real that there is a biological clock and a window for women and men, but more significantly for women. So peak fertility for women is in their 20s and at most early 30s. We're talking up to 32, 33. The longer you wait before you start planning, the lesser the number of eggs you have, the more the complications, the more trouble also you have conceiving. So that is probably the biggest factor leading to a fertility decline across the world today.
Okay. So you're trying to say that if you intend on becoming parents, then you need to consider your biological clock. That
Absolutely.
does not stop.
It is not going to stop for anyone.
Okay. I think to some extent people have knowledge on, biological age, fertility, infertility issues setting in. But compared to 20 to 30 years ago, has that knowledge led people to come to you much earlier? Or are they actually delaying it because they think they know?
Thankfully, I would say, it's a trend towards the former. People are approaching us earlier. Earlier, the concept of checking your fertility or checking your ovarian reserve, all of this never existed. Now, I regularly have girls as well as couples coming to me before marriage or just after marriage to see how much time they have.
Wow.
So this mainly gives us the opportunity to check a woman's ovarian reserve. Basically, we do this via certain tests that tells us how many eggs she has left.
Right.
And once we're able to determine this, we can give them kind of an idea that, okay, you are okay to wait for a couple of years, you're okay to wait for longer, or, there's something that's actionable right away and we have to do something. So if we're able to do that, we are able to reduce the problems in a lot of people.
Okay.
However, this is a small subset of maybe about 10 to 20% of the people I see in my clinic every day. The unfortunate large majority are people who are still waiting because of the reasons we already discussed. Right. They're not ready, etc. And this is taking a lesser priority, than the other things that they want to achieve first or certain other goals they want to get to first.
Right. I mean, initially, right, infertility issues was actually something that was associated to your later reproductive years. And somehow we see that changing. But is that really changing? Do we have younger couples who are also struggling with infertility?
Yes, definitely. I think, just for an example, my grandmother had 14 children from the time she was maybe 15 or 16 years old till the time she was 40, right? Till the time she hit menopause. And that entire window was filled with pregnancy after pregnancy. Whereas now I regularly see couples where, you know, the woman is 25 to 30, the man is between 30 to 35, and things are just not looking good for them. So because of the combination of the lifestyle, stress, etc., we are seeing that ovarian aging by itself is happening earlier.
Okay.
And there was a recent large meta-analysis also which was published, which said that especially in the Indian population, ovarian aging is happening about 2 or 3 years earlier than it is happening in the Caucasian population. So we are not sure of the reason for this, whether it is genetic, whether it is environmental, but it is definitely a trend that we are seeing, and it's quite concerning.
Okay. I mean, it's interesting to see, because what fertility meant for our parents no longer means for us, because we're living in environments that are very different to what our grandparents lived in, right? So in comparison to them, realistically today, if a young couple is thinking of having kids, how long do you think they should continue to try until they can go and see a specialist?
So as per our clinical definition, what our WHO says, 12 months of unprotected intercourse, that is intercourse without any form of contraception, if you're not getting a positive result, is when you seek medical care.
Okay.
But generally, we also say if you're above the age of 35, male or female, 6 months is when you draw the line and seek help. And by help, I mean specifically visiting a fertility specialist.
Okay.
So a lot of the times, the problem or the mistake that happens is they tend to approach a general gynecologist or a general physician, and they just give them the general advice that keep trying, you know, everything is looking normal. But there are certain things that we see that they wouldn't, because we are super specialized in this very field.
Right.
So if there is anything concerning, or if you just overall want to get tested, even if it's not been 12 months, if it's been lesser also, I would suggest meeting a fertility specialist right away, so you're given the right direction and the right guidance.
Is it a good idea to actually go and get yourself tested before you start thinking about having kids, even before you try?
Right. I definitely think so. So like I said, 10 to 20% of my clinic patients are that category. I wish it were more, because interesting story I want to tell you is I had a 32-year-old lady come to me just thinking of planning pregnancy.
Right.
And we found out that her egg reserve was dismally low, 0.2 in what it's supposed to be 2 or more. And in fact, she had visited a couple of other doctors before me who had told her that it would be impossible for her to conceive with her own eggs. And she had her egg reserve or her AMH testing done just 2 years or 3 years ago, and it was normal.
Okay.
Or it was on the lower end of normal, I would say. And she actually told me that I only wish I was given this information earlier, so I could have had more time to take a decision about what to do. And the difference was that time she had not seen a fertility doctor.
Right.
And now when she was faced with this, it's kind of a do or die situation where you're like, okay, I have to go for IVF right away, or I just don't even have that much time. Whereas if we'd have seen her earlier, we might have had an opportunity to do something else.
Yeah.
So that is why I think, you know, this is not something that's going to take a lot of your time, a lot of your energy, your money. No harm in getting it done. Like people get your annual regular health check, blood work, hemoglobin, sugar, etc. This should also be something that you're ideally doing.
Yeah. I think early diagnosis, right? That is preliminarily important in any kind of health issues. Okay. There is this one word that I've not gotten my head around. It's called unexplained fertility, infertility, right? For me, I think everything should have a reason. Like, we should be able to figure out the root cause of why something is happening. And when I go into the clinic and they say, hey, you know, it's unexplained, then it actually is quite disappointing for me. So is there really any truth to the fact that something is really unexplained? Or is it that we've not tested enough? We've not gone deep enough?
So when it comes to infertility, we have a rule of 30. 30% of cases are due to the male factor. About 40% or so are due to the female factor. Unfortunately, that does give us about a 10% unexplained rate. The remaining 30% is, there are combined, both factors are there. But there is that 10% unexplained infertility that we do come across. And in unexplained infertility, I actually tell my patients it's that science has not advanced to an extent where we're able to find out every single cause. So this might be in that realm where unfortunately there is some explanation, we just don't have the tools to find it yet. And as per our guidelines and our protocols, in unexplained infertility, we straight away go to an intrauterine insemination. If that doesn't work out,
that is?
That's where we are going to help give medications to the woman to release the eggs, take the man's sperm sample, process it in the lab, and put it directly inside the uterus. It's not major in terms of a treatment. No pain, not much of rest or anything required after the procedure. But in unexplained, we don't wait for natural or for just medications any longer. We have to straight away go with some sort of assisted reproduction. And if the IUI does not work, go for an IVF.
Okay. So this is after you've tried everything else and we cannot come across what the issue is.
After we've tested everything else and we've not found any reason. Yeah, when we label them as this unexplained.
Okay. This segment has to be my favorite because I like when we talk about everybody. Usually what happens is if there is no child, the women must be wrong. And if it's a girl, boy, or if it's a girl or a boy, it is because of how the woman is. People don't understand that, like you mentioned, a man and a woman have equal parts to play. So are we actually seeing a change in how male fertility also is? Is male fertility decreasing as well?
Yes, significantly. I think that decline that we talked about is affecting men as much, if not more. Specifically, we all, when we get together, we fertility specialists, we talk about how often we're coming across it, especially post the pandemic. I don't know if it's a combination of the work from home, lifestyle, stress, environmental exposure, whatever it is. But we are seeing it nearly at a 40 to 50% rate. In our clinics these days. And this might not be major issues, but almost all of them have some degree of, weaker sperms or abnormal looking sperms. And these are correctable, thankfully. But they involve a lot of motivation and lifestyle changes from the male partner.
Okay, I like how you said lifestyle changes. So a lot of us are into smoking, drinking, vaping. We think vaping is healthier than smoking. I don't know how true that is. But how do they affect the sperm quality?
So smoking and vaping are, I would say, the worst possible things you can do.
One is not better than the other.
One is really not better than the other.
Right.
Nicotine damages the sperm's count, the number of sperms that you're actually producing, the motility, the strength of the power of the sperms, and the morphology. Now, out of all of these, the morphology of the sperms is the most difficult to correct. So morphology is the structure of the sperm. And what nicotine and smoking and all of those do is cause oxidative damage to the sperms. That is DNA damage. So you might be producing good sperms, but the DNA is faulty. So these are not sperms that are going to be able to fertilize the egg. Even if they do, they're going to end up causing abnormal embryos, which cause miscarriages or, abnormal fetuses, which are just not going to grow.
Okay.
So nicotine in any form, smoking, vaping, e-cigarettes, all of them is equally bad. In fact, I think that's totally a misassumption that vaping is better than smoking. Alcohol, I would still be more forgiving and say, the occasional social drinking isn't really that bad. But smoking would definitely have to stop.
Okay. I've seen some videos on Instagram, where they say, I see like some men saying, it's not just the women who has to be healthy, but if I'm trying for a child, then at least 6 months or 1 year before, I need to start working out. I need to keep myself healthy. How much does that help?
Very much. So a good lifestyle in men that involves healthy diet, exercise, stress reduction, good quality of sleep, all of these things do lead to healthier sperm. And I'm sure that's, even I saw a lot of those videos where they say that there are certain characteristics of the child which is determined by the sperm. This is not just physical, like hair color or eye color or whatever. It's also behavioral. So this, and again, it's not just while conceiving, but it's also the 9 months of pregnancy.
Oh, really?
Yes.
How does that?
So that's environmental, and during the pregnancy, it's not just the mother who has to be taken care of. The father very much has to be present, even during everything. So lifestyle changes, not just for the woman. Do not blame or hold her solely responsible. And unfortunately, at least I have seen in my clinic that a lot of the couples who come to me, the woman is almost immediately accepting of the diagnosis and motivated to go ahead with the treatment with a lot of compliance. Whereas for their husbands or for the male partner, it takes so much coaxing and cajoling for them to even come and give us that one semen sample and then come and discuss the results. And then there's a lot of denial that no, I didn't give the sample at the right time, or I was sick before, so that's why this happened. And even compliance to treatment, we give them medications. They sometimes say, oh, I forgot to take it. I was busy with office. It's causing some gastritis or some minor side effect and I don't feel like taking it. So it's really hard for us also to explain. Plus, it's harder for us to see what the female partners are going through. They are struggling so hard, whereas the husbands are not that cooperative.
So if a man would like to test his fertility and see how his fertility health is like, what are some of the tests that he can actually take?
So the simplest and the first test that we recommend is a semen analysis. Wherein we check the semen sample, look at the count, the motility and the morphology. If there is any issue, we move on to second level testing. This involves hormonal tests like testosterone level, and FSH and LH, which are reproductive hormones. And we can also go for an ultrasound or a scrotal Doppler to actually visualize the testis and the blood vessels around it.
All these are non-intrusive?
None of them. A blood sample, if you would count as an invasive test, that's a moderate. But yes, nothing, no surgical procedure or anything of that sort. But even the second level tests are only recommended if we're seeing anything abnormal with the semen sample.
And this is good to take after you've tried, before you've tried?
Even before you've tried, you can overall get an idea of how your fertility is looking. And any major red flags can be picked up even then.
Now, when we think about women, right? From your experience, what do you think are some of the common reasons to why we see infertility in women?
So, in women, when we are looking at fertility problems, we look at three major organ systems: the uterus, the ovaries, the tubes. So there are issues with all of these which can cause fertility problems. When it comes to the uterus, could be problems like fibroids or polyps or abnormal uterus itself, which cannot harbor a pregnancy. Tubes, we know, is the site where the fertilization happens, where the egg and sperm meets and an embryo is formed. So if there is blockage in the tubes or the tubes are unhealthy, that's a second reason. And the ovary, I think, is the most important of them all. Any sort of hormonal imbalance that affects the ovulation, the egg release or the egg quality, can cause fertility issues. So all your PCOD or low AMH and thyroid or prolactin issues, all of them affect the ovulation in some way. And that can, of course, cause fertility problems.
In the very beginning, you mentioned something called the ovarian reserve, right? Could you explain what it really means and how it affects the chances of a woman becoming pregnant?
Right. So in women, we are born with all the eggs that we will ever have in our lifetime. In men...
And is that enough for all the cycles we go through?
It is. It's more than enough, actually. In men, they have the ability to keep producing new sperm until, their late 70s, 80s, maybe even till death. But in women, we are born with a certain number. We keep losing some every month. And then eventually we run out, which is when you have menopause happening. Now, it does not mean that only one egg is coming every month and you still have many millions left. Every month we are losing thousands.
Oh.
There are many coming up to the surface. Only one is growing, but the rest of them are undergoing a process called atresia, wherein they just die out. So it's not a very efficient process, unfortunately. Now, we know that this ovarian aging process starts somewhere in your late 20s and early 30s. And it kind of declines very steeply post about 33 to 35, which is when we want to make sure that before that steep decline happens, we're able to give you some sort of treatment so that pregnancy happens earlier.
Okay.
So when it comes to testing ovarian reserve, there are two primary tests that we get done. One is a blood test called as the AMH, the anti-Mullerian hormone.
Okay.
This is an absolute number that tells us how many eggs you have left. It tells us at this point. Now it can decline. But this rate of decline is not in our control. So it can go from a 2 to a 1 in 6 months, or it can go in like 5 years. That is not really in our hands.
Right.
The second is a scan that we do during your periods, a vaginal scan, where we look at the number of eggs that we are seeing at that point. So that is called as an antral follicle count.
Okay.
So we actually count the number of eggs. And that also gives us some idea of how the reserve is at that point.
Okay.
So these are tests, again, which I recommend my patients to take as soon as they hit 30 and maybe do it once a year to see the trajectory. That's very individual to each person. And that again will help you take a decision about your fertility and your plans.
So just like how we spoke about how smoking or the environment that you are affects the sperm quality, how does those same factors affect a woman and the egg quality?
The very same way, it causes oxidative damage, DNA damage, poorer egg quality. In women, it also affects the other organ systems. So particularly when we're looking at poor lifestyle, I would say PCOD is a problem. PCOD or PCOS, polycystic ovarian disease, a problem that we're increasingly seeing in younger women. This is a condition where there are a good number of eggs, but because of the hormonal imbalances, none of them are releasing.
Right.
So this is causing no periods or very delayed and irregular periods. And it'll cause you to gain weight, mood swings, acne, lethargy, just overall affect your quality of life. And PCOD is unfortunately increasing because of the poor lifestyle factors that we are seeing. So a lot of it is correctable, but I'm seeing it much more in younger people nowadays.
I like how you said a lot of it is correctable, right? Could you just give us a picture of what a healthier lifestyle would look like?
So when it comes to PCOD, weight, I think, is one of the primary factors we have to consider. And it involves getting into a normal BMI range, 19 to 22 or so. The sad thing is PCO girls also find it much harder to lose weight because their metabolism itself is slowed down. So this might not be just via diet and exercise. It might need other forms of treatment as well.
So some of these lifestyle practices that you mentioned, right, becomes quite challenging, especially for people who have 9 to 5 and they come back and that's very little time they get. They're exhausted, especially in the traffic, and they just want to relax. So are there at least 1 or 2 things that they can change that can actually make an impact?
I think exercise at least 3 days a week. You count 2 of those days as a Saturday and Sunday, and find 1 day in between when you can, just take that half an hour or 45 minutes to work on your fitness. And the second thing I think is healthy eating with fresh produce, cooking for yourself. So it is something that's very difficult to do on a daily basis, requires a lot of motivation, but very doable. Parents have been doing it. Even we do it when the necessity arises. We're a spoiled generation because we have everything available, in that 10-minute availability, which really makes us not take that effort, but it's really worth it in the long run. So I think home cooked food, exercise.
Okay. All of this will impact the quality of the egg. There is no control over the quantity, right? So can you stress a little bit about how one is important than the other? Like both are equally important, or should we focus on quality because we don't have control over the quantity?
So both are equally important. And yes, you do have control over the quantity in a way that you can detect declining egg reserve early. And thanks to science, you can actually put a pause on that ticking biological clock by doing egg freezing or embryo freezing.
Yeah, can you tell me about egg freezing?
This is a process wherein we harvest your eggs, we give injections to grow as many eggs as possible and extract them out of your body and then put it on ice or put it in the freezer. So what this does is you always have a backup of eggs. It's like an insurance in the bank. As and when you want to plan for a child, you can go ahead naturally. But if it doesn't work out, we can use these eggs and they are not going to be aging any further. So if you've frozen your eggs when you're 25, if you want to plan pregnancy at 35, you're still working with 25-year-old eggs. So their quality is going to be as good as a 25-year-old's. So I think this is a radical and amazing technology. And for everybody who's unsure of whether they want to be parents, when they want to be parents, definitely go ahead with this. It's barely a blip when it comes to the cost of maybe a domestic trip that you take for a week. But the insurance policy that it offers is for your lifetime. And you can live free and without regret and decide when you want to plan a family on your own terms. So egg freezing, embryo freezing if you're married, where we fertilize the eggs, make an embryo with your partner's sperm and then freeze that. Both are wonderful options for such people.
You know, in India, especially with the kind of society that we have, though these are very great techniques, very great opportunities for us, these are not seen as medical help. They are seen as, oh, that's too modern, right? We don't want you to do this. How do we break that?
So I think by talking about it more, starting to have these conversations with our parents, with our friends in the younger days, at least when my generation becomes parents, I would definitely talk to my daughter about this for sure. So by increasing the awareness and the opportunities for it, I think we will make it more acceptable. Not just this, but assisted reproduction in all forms. At the end of the day, I think your generation, the Gen Z, are much better than we were at facing all the societal stigmatic talk. You know,
a lot of people should know that.
So we were still very closeted and very scared of what people would say. And I think your generation is really breaking that and saying, okay, we're going to be how we are without any fear or any embarrassment or anything like that. So I'm hoping that situation improves as we go forward. And the same thing holds to couples who are approaching us. You know, I see so much fear that, okay, what if my own relative sees me walking into an IVF clinic? What are they going to say? You really shouldn't care. And the people who are talking about it are the ones who should feel ashamed that you are commenting on something that's perfectly natural, that's just a tool to help people. You would not stigmatize a person walking to get their ECG or ECO, or you would not stigmatize a person walking to get a cancer screening test. This should be along the same lines, really.
I think it's very interesting you said that, because, you know, once you know that a baby is born, oh, was it a normal delivery or was it a C-section? Oh, was it a C-section? They're very disappointed about it. So I think that shift of, you know, talking more about it and helping people understand that this is medical help. Right? It's good that we have it.
Right.
I just want to touch a little about sex in itself, right? Now, sex in India is a very awkward topic. And sex education also is very sparsely there in our system, right? So in times like this, what is normal during sex and what is abnormal during sex becomes very gray, right? So when a woman is actually experiencing pain during her sex, is that natural, or is that a sign of some kind of infertility issues?
So, pain during sex, or medically as we call it, dyspareunia, it is quite common, and most of the time it should not be happening. So, everyone in those initial few sexual experiences can experience some amount of discomfort, but as you get into the groove, you really should not be experiencing it. I think statistically about 10 to 15% of women have a condition called as endometriosis, which is a pretty terrible condition to have, really. And this is almost about 50% in women facing infertility. Fertility issues, we see it so much more common. And endometriosis is a condition which is typically characterized by pain during sex. So if I would say to any girl out there, you are experiencing pain during sex, please don't ignore it or think it's some problem with your body, you're not lubricating enough or whatever it is. Seek help, because there's actually a real medical reason behind this.
It's very interesting. Since we're talking about shame and everything, I'd definitely like to ask this. So in India, at least, having a child is not a biological expectation, it's a social expectation, and it becomes emotionally demanding because it's not just you who's waiting, your entire extended family is waiting for, okay, when are you going to have kids?
Good news.
Yeah, when is the good news, right? So it becomes very challenging for people. What do you think we can do to actually shun those voices? Because even when we are saying, I'm going to work out because I'm planning to have kids, then they're going to be like, we've had so many kids without doing anything, so you don't have to do anything. They become a reference point.
Right.
How to change that?
So I think this is not for us to understand. It's for the people who are asking those questions, that things aren't as easy nowadays as they were before. This is both from a medical standpoint as well as from a societal, financial standpoint. It is getting harder for people to have kids. Don't ask those questions before you know what they are going through. Right. Everyone is going through their own challenges. And you never know, they may be taking treatment for infertility. They may be having a bad relationship. They may be going through some financial struggle. So I think that entire question of, when are you giving us the good news, you should just take that out of the equation. Yeah. And also, to the people who are facing this, I think build up your emotional resolve a little bit more, build up that shield a little bit more. Don't let this affect you, If they're asking it, fine, just let it be. Because it is only going to spoil your mental health rather than really lead to any successful transformation. You know what you're going through. Let them ask what they do. Just let it out from the other side.
Yeah. Underlying, just don't care. Do your own thing. Okay. I'm hearing a lot of IVF and IVF as a good medical help, right? Could you briefly define what IVF really is?
So IVF is in vitro fertilization. It is a technology which actually started in the 1960s and 70s. It's old at this point. So only now it's become more universally accessible. And also it has improved in terms of success. So back then, the success of an IVF would be 10-20%. And now we are at 50 to 60%. So it's a technology by which we are able to fuse the egg and the sperm outside the body in vitro and form an embryo. And then put this embryo back into the uterus where it can implant and form a pregnancy. So we have many, many offshoots of this where it's advanced, where we can use a third-party egg or sperm donor, or use surrogates, or select sperms like we talked about, select the best quality eggs, do advanced genetic testing to make sure that the embryo is normal. So there is a lot more advancement that has happened and is continuing to happen. So it's a very exciting field to be in. But overall, it is a tool wherein we are able to do a certain level of the fertilization process outside in the lab in our control. So we are able to give you much better success in terms of a pregnancy.
Okay. That automatically leads me to the next question. Outside the body, right? So is that baby really going to be ours? Is the lingering question.
Right. So yes, if you have consented, only then we will be using somebody else's gamete, a sperm or an egg. Otherwise, it is definitely going to be yours. We have a lot of people who ask us this question. So I always tell them, look, legally, I am going to be in jail if I do something that is, not what you have consented to. And we have many fail-safe mechanisms to stop a gamete mismatch or an embryo mismatch from happening. We have double checking of every single thing where we are freezing before transferring. We have barcodes and radio frequency tags and color coding. We have a 2-person check. So it's going to be checked by my embryologist and by my nurse, or by my nurse and myself. And strict ledger monitoring, maintenance, accountability, and meetings to make sure that this sort of a thing never happens.
Okay.
So most clinics have a lot of these in place. We have guidelines from multiple societies. The one we follow is the European Society called as ESHRI, which is the gold standard. So there's a strict bunch of protocols and rules that we follow to make sure that such a exchange or a mix-up never happens.
In the IVF, could you highlight a little more about if there is no success? Is it on the woman? Is it on the man? Or is it on none?
It's on the embryo, which is a combination of both you and your partner. Yeah. Exactly what is the problem, which gamete is responsible is not something we can, really determine. But scientifically, we know that the overall success rates are not more than 50 to 60%. And if, unfortunately, we are facing an IVF failure, we dive deeper, do secondary level testing, try to find out which is the problem element so we can work towards that and get a better result the next time.
Yeah, I think we should stop blaming everything on the women when it comes to pregnancies.
Definitely.
So you've seen so many patients, right? Now, when they walk in, are they really scared of being judged inside the clinic too? Because that's the same thing that happens outside the clinic.
Probably, I think less at this point. We aim to, at least at Motherhood, have a safe space where we can have an open discussion about what are the issues a couple is facing, how we can treat it, how we can go about it. So I hope that my patients at least don't feel judged after every consultation with me. And I think across the world, we are having more IVF clinics, which are going to be places where you feel safe. And also, we have to understand that a patient with a fertility issue it's not a one-time visit. I have patients who come to me 3 times a week for months on end, right? So this is something that kind of becomes like a second home. As unpleasant as the entire journey is, it has got to be a place where you feel safe, you feel secure, you feel comfortable. And I know patients who have my nurse's number on call, who have my number. Anytime they have any issue, they're actually quite happy to talk to me about it. Yeah. So that is, I think, the end goal, to make every couple who comes to us happy with the experience that they have.
So you said this becomes their second home. Now, what should one actually consider when they're choosing an IVF center? Any key points?
First and foremost is your doctor. You have to feel comfortable talking to them. You have to feel like they are going to be available to answer your questions. They are going to consider your wishes in any treatment plan, and you're going to have a shared decision making. So primary importance. Second is the IVF lab itself, if you are planning for an IVF treatment. So the embryologist in the IVF lab is 50% of the result.
Okay.
So make sure that you're checking. You can actually be upfront and ask them, what is the result of your lab? What is the rate of good quality embryos? What is the rate of twins? What is the rate of complications? All of those things. And then make a decision based on that. Third is end-to-end care. So you can't be shuffled around like a ball, like, okay, you want a scan, go to this center. You want a hysteroscopy, go to this center. Once you get pregnant, go to that other center.
That's exhausting.
So make sure that the place that you're choosing has everything in-house. So you don't have to travel or coordinate and do all of those things. And fourth, everything available, including the lab. So your blood draws are done in the same place. If you need psychological counseling, it's done in the same place. If you need a dietitian, they're available. Everything is available so that your comfort, because you're going to be coming here so often. You're going to be leaving your office. You're going to be, having to struggle in the other aspects of your life. This also should not add on to that struggle.
Right.
And it's a place where you feel safe and secure and cared for.
Okay. I like how you mentioned in motherhood, we take care of all of these things. So can you tell me more about how motherhood as a hospital stands out in giving that holistic treatment?
So I think the end-to-end care is fantastic. I work with an excellent team of obstetricians, fetal medicine specialists, andrologists. So anytime I have even the slightest need for a referral or need for a second opinion, everything is right there. And so many times when I am sending one of my patients to a colleague after they've conceived, they say, no, we don't want to leave. I said, I'm right next door. You're just moving from my room to 100 feet away. And I'm always available for a consultation. And that comfort level is something we really offer at Motherhood. And people, at least I take it as a success, that most people don't want to leave us and go. Or when they leave us, it is with that baby in hand, So that is the true moment of victory for us. So I feel really happy when I'm just stepping outside my chamber and I see someone waiting for a scan. I'm like, oh, it's been 5 months already. And it's like, yes, you sent me now. She is doing my scan or she's taking care of me. And they feel well taken care of. So that is one thing I think we really stand out in.
Okay, that's interesting. So since we're talking about end-to-end care and everything, right? I remember when I first met a gynecologist as part of my annual health checkup. I was petrified. I was like, why should I go to a gynecologist? Like, I've never been to one. So I'm very unsure of what's going to happen the moment I enter. So could you throw some light on what actually happens when you go into an IVF center?
So the first thing is you're registered as a couple. And we make sure that we are, you have to fulfill an age criteria to be able to take fertility treatment. You have to be married, etc., etc.
Okay.
Once that formality is done, you will be straight away directed to your doctor. There's no middle person who's going to take your history and whatever. And we ask a basic history of why are you here today? What is it that you're looking for? If there has been any treatment done in the past, or if we have to start afresh. And right then and there, if necessary, we go for an ultrasound. We'll help you with your blood draw, so we get your blood check done. And post that, if you need a tubal testing or anything, any procedure that's planned, we'll help out with that. And after the entire consultation cycle is completed, we make sure that you are going home with the instructions of when to follow up next. Any doubts that you have, medications are available. Our pharmacy is right there. So that is how the first consultation or the cycle of consultation looks. From the subsequent visits, it's much shorter procedure where you're just going to be coming, taking your injections or getting the tablets that you require, getting your scan and going home.
Okay. Now, when we think about hospital expenses, right, it seems very scary. Because, what if my insurance will cover it? How much can it cover? So a lot of these techniques of IVF, egg freezing, they all seem very expensive and out of reach. So we think it's only for the elite.
Right.
So is that really true?
Thankfully, I think one of the good parts about corporate culture is that corporates are also understanding how financially draining these treatments can be. Most of them are now included in corporate insurance.
Okay.
Almost entirely covered. So all you have to do is make sure that it's included. The HR policies are going to help you with that. And then we have a financing team itself in the hospital who will help you to apply. So you can do it cashless, or you can do a reimbursement, or whatever it may be. We also have installment options if you don't have any insurance options. And we have a team to help you go through this entire process and explain to you in detail about the payment, the options, what you have if you're not able to afford. We have discounted packages, rural packages, so many options to make sure that that should not be the one thing that's holding you back from, really getting the treatment that you need.
People have scared me. They say, you know what, having kids is expensive. So it's good to know that there are so
Once
many.
Once you have them, it's expensive. Before that, it isn't really.
Okay. But do you think that if we actually go early, get ourselves diagnosed early, do you think all these expenses will actually come down?
Yes, because earlier the diagnosis, more options that we have in terms of treatment. So somebody who might need an IVF 5 years down the line now might just get pregnant naturally. And it's a myth that the minute you walk into an IVF clinic, they're going to ask you to do IVF.
Yeah.
In fact, 70 or 80% of the patients we treat are patients who are trying to achieve a natural pregnancy with barely any assistance or just tablets or minimal things. So if we see you early, we can help you out with even that, so that it doesn't have to reach a stage where IVF is your only option. And the earlier you come to us, the better we are able to help you out with the options available.
Okay, this is the lightning round. Are you ready, ma'am?
Bit scared, but yes, I'm ready.
Okay, so let's start off. What is the best age to freeze eggs?
Late 20s or early 30s.
What is the IVF success rate in India?
40 to 50% upper limit.
Okay. What is the most important fertility vitamin?
Folic acid.
Can you drink coffee during IVF?
1 or 2 servings max.
What is the biggest fertility myth?
Keep waiting, it'll happen.
When to see fertility specialist?
Before 30, 1 year. After 35, before 35, 6 months.
Okay. IVF versus IUI, what is the main difference?
IVF is fertilization outside the body. IUI is fertilization inside the body.
Okay. Can PCOS patients do IVF?
Yes, definitely. One of the best techniques for them.
Okay. How many eggs do we need for IVF?
12 to 13 is that magic number.
All right. One more for couples who are starting IVF.
Resilience.
All right, that was pretty quick and on the spot. So thank you so much. This was our lightning round, and I'm sure we got a lot of inputs just from this small section. I think the one question that everybody watching this podcast wants to know that, you know what, I'm trying. I'm exhausted and I'm filled with guilt and shame. The reason why they're watching this podcast is also they're trying to figure a way out. So what is that one thing that you'll actually tell to couples like these?
Like I said, resilience, if it's not happy, it's not the ending. Keep trying or seeing the next approach. And don't fall for those myths that tell you that IVF is bad, it's the last option, the baby's not going to be healthy, something really bad is going to happen to you. IVF is science. And just like cancer requires chemotherapy, fertility problems sometimes require IVF. So I think once you've made up your mind that, yes, this is not that big a deal, it's just another form of treatment, meet the right doctor, go ahead with it with a lot of positivity and very less apprehension. It is safe. And if somebody says, IVF is being sold to you because people want to make money. Honestly, I don't make a lot of money out of IVF. 90% of my couples get pregnant naturally, and only 10% actually end up going for IVF. So if you've met the right doctor, the right hospital, the right fit, trust the treatment that your doctor has advised for you and go for it with a lot of positivity.
Yes, thank you so much. I think with the way our fertility is declining, this is a lingering question in many of our minds. And I think thank you so much for having this conversation with me, because especially for me, who's somebody very young, I feel completely clueless on entering the next phase of my life, right? So having people like you who can actually come and speak, I think that what makes a huge difference. And I'm very happy to have this conversation with you. And I must say this, it is very impressive to see a person filled with this much knowledge, but it is very inspiring to see a person who's willing to share that knowledge. So you have been an inspiration to many, filled with knowledge to come and share. So thank you so much. That was a lot of information. And I think this brings us to the end of this podcast. Wonderful talking to you, Dr. Bhavana.
Thank you so much, Ishma. It's been a pleasure. Thank you.